Welcome to the Macmillan Report. I'm Marilyn Wilkes, your host, and our guest is Jeremy Seekings, a visiting professor at Yale in the Ethics, Politics, and Economics Department and the International Affairs Council. Professor Seekings is based at the University of Cape Town in South Africa, where he has a joint appointment as Professor of Political Studies and Sociology. Professor Seekings leads a variety of research projects encompassing both quantitative and qualitative research. These include studies of adolescence, race and class, violence, AIDS and poverty, social policy, and politics. Most of his research concerns South Africa, but he also conducts research in Brazil and the Caribbean and other parts of Africa. Today we'll talk with Professor Seekings about his recent article titled Deserving Individuals and Groups, the Post-Apartheid State's Justification of the Shape of South Africa's System of Social Assistance. Welcome, Professor Seekings.
Thank you very much. It's a pleasure.
Tell us about the premise of your paper.
Well, this paper is a paper looking at the South African welfare system. And the South African welfare system is quite distinctive in many ways, which I think makes it interesting to a variety of audiences. Welfare systems around the world typically involve some combination of what are called social insurance programs and social assistance programs. Social insurance programs, such as Social Security in the US, are contributory programs where people become eligible for benefits, old age pensions or whatever, on the basis of the contributions they're making when they're working. So those are programs that are primarily designed and intended to provide for financial support for working people when they're unable to work. The other kind of program is social assistance program. And the social assistance programs, or what Americans call welfare, are programs which are non-contributory generally, and that they are often means tested, whereby support is given to particular categories of people on the basis that they are considered deserving. So the poor in America get financial assistance for medical expenses. There was the AFDC program for single mothers. And in many parts of the world there are also old age pensions for the elderly, which are not linked to their contribution record, but they're a non-contributory right, if you like. Now, South Africa is very unusual because South Africa has a very undeveloped contributory system, but a very extensive non-contributory system. So it has very limited social insurance, but very extensive social assistance. Now, this is a very unusual combination around the world, and it has all sorts of consequences. Now, the one important consequence is that with social assistance programs is that who gets them reflects very much who is considered deserving by political elites or by society as a whole, depending on the history. But who is considered deserving? What kinds of poor people are considered deserving? And in South Africa there's been a big debate about this recently because poverty is very extensive and many poor people are not in those categories of the deserving poor who have been recognized as deserving in the design of the welfare system, the social assistance system. So in this particular paper of mine, I was looking at the way in which certain groups of poor South Africans are identified as deserving and get covered by the social assistance system. But other groups of poor South Africans don't. And I was looking at why the state, or how I should say, the state justifies this inclusion and exclusion of different kinds of poor people, saying some people are poor and other people are not.
Okay, so give us an overview of the social assistance system in South Africa today.
So the South African social assistance system really identifies three groups of people as really deserving. And these are the groups of people that you'd expect to be considered as deserving in many parts of the world. And so South Africa is not unique in recognizing these groups as distinctive. It's unique in the global south in the extent to which it has included these groups in its welfare system. So the first is the elderly. So South Africa has a very generous system by global standards of old age pensions. And my paper was focused on one aspect of this, that old age pensions are given to women from the age of 60 and men from the age of 65. These are non-contributory, they're means tested, And that means that when you apply, you have to show that you don't have extensive other sources of income or great wealth. In practice, 90% of the elderly get the pension. So the means test is really just a way of not giving it to retired university professors, for example. So almost everybody gets the pension, but there is a means test. But if you satisfy the means test, then this is a pension which you get as a right from 60 or 65 if you're a woman or a man. That's the first part of the welfare, the social assistance system. So the elderly, they're considered deserving. The second group who are considered deserving are the disabled, right, who are unable to work, but because they're disabled or chronically sick. And in South Africa, this has actually become quite a political or social hot potato because large numbers of people have become sick because they are sick with stages 3 or 4 of AIDS, and so a lot of the disability is AIDS related. So there's the second big category of people in South Africa who are considered deserving are the disabled and the sick. And the third category are children. And in many countries around the world, there is some recognition that children should, society has some responsibility to make sure that children don't grow up in poverty, or at least not in extreme poverty. And in South Africa, there is a system of what are called child support grants. And these are grants which are given to the parents or the guardians of children where the families are very poor, and the idea is that this will give the family a sufficient minimum that at least the child will not go to school hungry and will not go to school without any shoes and will have a better opportunity in life than if there was no support. So those three groups, the elderly, the disabled and children, are identified as deserving poor. Now, there's a lot of poor people who don't fit into those categories, of course. South Africa has very high unemployment and problems of landlessness. So people don't have access to wages or earnings. They don't have access to subsistence agricultural production. There's a lot of people who are very poor. Now, some of those people, of course, live with the elderly, they live with a grandmother, or they've got children, or they live with someone who's disabled. So indirectly, they might benefit from the welfare system, although they're not considered deserving as individuals. But then there's plenty of poor families who have no children of an eligible age for the child support grants, which used to be up to the age of 14, who aren't living with the elderly or aren't disabled. They just don't have work and they don't have land. And those people are overlooked by the welfare system. They're not considered deserving in terms of the design of the welfare system. And so there's some debate about should the welfare system include some or all of them. Now, my paper focused on one particular group of people who were excluded, which was men between the ages of 60 and 65. So women get the old age pension from the age of 60, but men only got that old age pension from the age of 65. That was just gender discrimination. And this was justified by the South African government on a number of grounds. The first being that women are generally disadvantaged, and the second that women are more benevolent in how they use their pensions. And if you give them money to a grandmother, they're more likely to look after, to share it with other needy members of their family than if you give it to an elderly man. So there are these two arguments which the state used to justify why it was discriminating in favour of women and against men in this age group 60 to 65. And I used this as a case study to interrogate the way in which the state was constructing its categories of who is deserving, what kinds of evidence it used to support that argument, and what were the empirical and conceptual normative flaws in its argument.
Okay. And is there a difference between apartheid and post-apartheid in terms of what the state is providing?
Well, this is curious, because when you tell people that South Africa has this very distinctive welfare system, which, and I could maybe give an example of how distinctive it is. So South Africa spends about 3.5% of its GDP on these social assistance programs. Now, we don't know any other case in the global south which spends more than 1.5 or 2% of GDP. So South Africa is spending more than double even places like Brazil, which has now got quite big programs, Mauritius and other cases which are recognized as unusual. So in global terms, it's a very distinctive welfare system. And most people, when we talk about this, most people say, well, this is clearly because of democratization. And we know that from in all sorts of fields that democratization matters, democracy matters, and all sorts of pro-poor reforms are more likely to happen in a democratic than a non-democratic environment. But curiously in South Africa, these reforms did not follow the transition to democracy in 1994. In fact, they long preceded it. They became more generous in terms of the benefits after 1994, and they became more extensive in the number of beneficiaries has grown. But the core elements of the welfare system actually go all the way back to the 1920s to the 1940s, in fact before even apartheid. So these are very, very well established elements of the welfare system. Now, some of my other work, I've looked at the history of these programs, and they were typically introduced to benefit white and what in South Africa are called coloured people, in the relatively privileged groups, and they were quite explicitly intended as a vehicle for discrimination. They were intended to raise the living standards of poor white and coloured people above the living standards of better off African people. So this was very much part of the ideology of white supremacy and apartheid. The governments at the time drew on the British model, which had old age pensions and other forms of support for the poor, but only applied them to the privileged members of the privileged citizens of South Africa at the time. But in the 1940s, many of these programs were deracialized to the extent that they were partially extended to African people. And that was a particular moment really in the Second World War in the 1940s when it happened. And that really the system which was put in place then survived all the way through, became much more generous in the later apartheid period, and is the basis really of this now very unusual welfare system. So it is it's a very long-standing system, right, which has its origins in a particular sort of moment in time, but where the outcome today was very different to what the founders actually intended 80 years ago.
What drew you to look at this? Why is this important to study?
Well, I looked at this for two reasons. The first is that I've done a lot of work on the comparative study of welfare systems in the global south, and maybe say a bit more about that in a moment. But the other reason is that I was asked to look at the particular question of why men in the 60 to 65-year-old category were excluded from the welfare system, because a group of men aged 60 to 65 brought a court case against the South African government saying that their exclusion, or to put it another way, the discrimination against men, because women of that age got the pension and the men didn't, this discrimination, this exclusion was not constitutional in terms of the Bill of Rights, which is part of the South African Constitution. And it was this constitutional court challenge which forced the government to articulate in much more detail than it usually would how it justified who was considered deserving and who was not considered deserving. Now the very strange thing was that the government got into a big argument as to why women were deserving, not men, and they could have just said, well, we inherited this from the apartheid state, right? Which would have been an answer. But they actually got into a justification saying that women were disadvantaged relative to men. And the lawyers for the men in the case asked, could I comment on this case? And so I was an expert witness in this constitutional court case. And I was able to show that most men who satisfied the means test were in fact highly disadvantaged. Because if they'd been advantaged in their lives, if they'd been people who had had regular employment, they would have had savings, they would have had all sorts of other sources of income, which would meant that they would have been lifted above the minimum income for the old age pension. So I was able to show that what was happening was that really disadvantaged men were being excluded from the welfare system. And these were men who probably had, they dropped out of school at the age of 12 or 14. They had spent a large part of their working lives in deep underground gold mines. They'd probably got, their health was probably impaired. They probably had spent, 15, 20 years unemployed. They had no other source of income. They had no skills other than deep level mining, and there was no demand for those skills from 60-year-old men. These men who were in many ways really very disadvantaged. And I was able to show that it was these kinds of people who were being excluded by the government's definition of the deserving poor. And as a consequence of this court case, the government, in fact, reformed the system, and now they've reduced the age of eligibility for men from 65 to 60, so that men and women are eligible for the old age pension from the age of 60, subject to satisfying the means test. Okay. So it has real practical consequence. Yes. Now that there are men in South Africa who get the pension and are not poor, right, not living in poverty, who without this reform would not have had this source of income, and had to wait another 5 years.
Yeah, that's wonderful. So let's talk about how you became to be an expert witness and how you gathered the data, that you brought.
Right. So the government's case was based very much around using empirical data to show that men and women were differentially advantaged and disadvantaged, that women enjoyed more disadvantages than men. And they were able to do that fairly easily using survey data, which showed that on average women get slightly less education than men, that they have fewer employment opportunities and so on. Now, I was able to use very much the same kind of data from household surveys, from labour force surveys, and now there's very good survey data of this sort in South Africa, as in many places, to show that, that there are some men who have obvious advantages, but those are typically the men who are still working in their early 60s and wouldn't be claiming the pension anyway. Right? But that there's plenty of men who actually share most of the disadvantages experienced by women in economic terms. And I was able to show that these were the people who are really being excluded by this construction of the deserving poor. So I was using survey data to link it to this very practical policy question.
Right. Okay. What did you identify as the weaknesses in the state's framework for their argument?
Well, the state says that the state argued that it was justified to exclude men of a certain age, but to include women, on the basis of a comparison of the mean education, the mean employment record, the mean of a number of economic characteristics for men compared to women. And I was able to show that, in fact, just looking at the means, looking at the average for men, average for women, isn't very useful when you have considerable diversity, considerable variation. And in fact, what you really want to look at is, what are the advantages and disadvantages of different men and different women? And I was able to show that the state had overlooked the disadvantages experienced by large numbers of men, not all men, but large numbers of men, in the way that they had constructed their empirical arguments. So it's also an example of really the how one should go about using survey data, for example, for scholarly purposes. And this is policy-oriented scholarly work. But it's clearly very important to look at the distribution of advantage and disadvantage, and not simply just look at average or mean values.
Sure. Okay. Why is this of intellectual interest in the comparative study of social policy across the world, do you think?
Well, most of my work on welfare is comparative, looking at the global South, and South Africa, I think, has two important lessons for the global study of social welfare, and these are really both linked to its distinctiveness. That, as I said, the most welfare systems involve some combination of contributory systems and non-contributory systems, social insurance on the one hand and social assistance on the other. In the global South, most countries through the second half of the 20th century developed welfare systems which focused almost entirely on the contributory side. that these were systems that involved pensions or health insurance, very occasionally unemployment insurance, but certainly pensions and health insurance for workers who were in formal employment, such that when they retired or if they were sick, they would be covered. So most countries in the South developed contributory systems which were workerist, in the sense that they were oriented towards workers in the formal sector. Now, South Africa is very different. South Africa had its underdeveloped insurance system, but a very highly developed assistance system, which wasn't aimed at workers primarily, but was aimed at non-workers, the elderly, the poor elderly, children, the disabled, and so on. So it was a very different model to the general model in the global South. Now, this is important for two reasons. And the first is that the fact that we have cases like South Africa reminds us that there were throughout the 20th century choices that governments made, colonial governments, post-colonial governments made, about the design of their welfare system. It wasn't as if the standard, what I call workerist choice, in other words, a welfare system focused on really urban industrial workers, right? That was not the only option. Right? There were other options, and South Africa had in fact gone down a different route. And in my other research, I've looked at other examples of countries or cases which went down a similar route. Some countries in the Caribbean, Mauritius, for example, and Mauritius is not in the Caribbean, but there's a number of other British colonies, mostly British colonies, which went down the South African route of this focus on non-contributory welfare programs. Now, if we look at South Africa and these other cases in a global context, we have to ask, well, why did they happen, and why were there not more cases of this sort? And a lot of my comparative work has focused on trying to understand both why we have these exceptions and why that they were unusual. So I've done a lot of work looking at the diffusion of ideas around welfare in the early and the mid-20th century, and the particular combinations of conditions which result in workerist or more social assistance type programs being implemented in different systems. So that's the one reason. It's a kind of historical reason to explain why do different countries go down different paths in terms of the design of welfare policy, and this would be true of other areas of public policy as well. The second reason why it's important is that in the last 20 years, there's been a huge upsurge of interest in the kinds of programs that South Africa has had on the books for a long time. So much of the enthusiasm around social policy reform in the global South is around programs such as the Bolsa Familia, which is a cash transfer system. It's a non-contributory system to families with children in Brazil, and there are many cases of what the World Bank calls conditional cash transfers of this sort, where the Brazilian case is replicated. There's also growing numbers of cases of where countries implement non-contributory pensions for the elderly on the South African lines. So there is this great upsurge of interest in this model, which wasn't very common for most of the second half of the 20th century, but in the 1990s and early 2000s has become much more common. So looking at the South African case can give us a lot more understanding of what kinds of conditions this reduces poverty or has particular consequences for particular groups of people. So in very practical terms, we can learn quite a lot from studying the South African case, precisely because it's now become a bit of an unexpected role model across many other parts of the world.
And why has it become such a role model? Why the transition?
Well, it hasn't become a role model because people study South Africa, curiously. I mean, it's an accidental role model.
Okay.
It wasn't the case that as people, policymakers, scholars in other parts of the world looked at South Africa and said, wow, here's an exciting program, why don't we copy it? In fact, the developments in Brazil and Mexico and other places which have been the recent pioneers in this kind of welfare reform have generally had their own particular internal reasons as to why they went this route, often without much knowledge of the South African case. One reason why the South African case is not well known is that the major vehicle for knowledge about welfare systems around the world for the last 50 years has been the International Labour Organization in Geneva, the ILO. The ILO collates and disseminates much of the information that policymakers use when they're rethinking their social policies. And the World Bank does the same thing increasingly as well. Now, the ILO expelled South Africa in the 1960s because of apartheid. That because South Africa had the apartheid system, discriminated against black workers, the ILO said, there is no place in the ILO for apartheid South Africa. So it was thrown out of the ILO, and the ILO stopped including data on South Africa in all of its data sets and reports. So right up until the mid-1990s, when apartheid ended, South Africa was right outside the normal, right outside the world which policymakers were drawing on when they were designing experiments. It was only at the very end of the 1990s, really in the last 10 years, that people have begun to say, wow, if we want to know what happens if you give the elderly old age pensions, we can learn from the South African case because they've been doing this for a long time. Right? But Brazilians, Mexicans, many other places introduced reforms before people had realized that there was in fact this role model to learn from.
Interesting. Well, thank you so much for being here with us today and sharing some of your work.
Well, thank you very much. It's been a pleasure.
For more information about Professor Seekings and his work, please visit our website at yale.edu/Macmillan Report. Be sure to join us again for another episode of the Macmillan Report, made possible through funding from the Whitney and Betty Macmillan Center for International and Area Studies at Yale.